is known as pranagati. And apanagati means such a functions which are outside of the body, expelled out or throw out or excrete from the body. That particular body function or movements is known as apanagati, which is very important. These two functions or movements for maintain the health. But when the suppression of these function, suppression of these natural urges, suppression of these opposite way directions, or disturbances between the two functions or directions, or obstruction or disturbances in between these two natural motions may cause of different pathogenesis or disease and disorder. So we must have to maintain these motions and movements of the dosha factor, particularly inside the physiological phenomena. Another one type of dosha gati is there described as according Ayurveda. We try to understand because we pay your attention very particularly, then we can understand why they are describing this way. We can think over it for very particularly. Kshaya, Sthana, and Vriddhi. These are also three particular directions or functions of natural physiological phenomena. But Kshaya means decrease the status of the body, which gets resulted into the pathogenesis again. And another one, Sthana, means add their dosha factors as their status in normal status and particularly at their location naturally in their particular balance status. That is one of the status. And another one, last third one status, that is vriddhi. Vriddhi means that particular motions of the substance which are the visual body components, kapha and pitta and rasa rakta, these body component or substance, wasted substance, which are aggravated. Again, such aggravated status of or status or directions or functions may cause of pathogenesis of the disease. So, the decrease the status or direction or decrease the physiological phenomena and increase the physiological phenomena status, we should try to avoid for purpose to prevent the disease and for purpose to prevent the disease unless the kshay or decrease the status of the body and increase status of the body are mostly responsible to the disease and disorders, right? Then another one, third type of motions are described very particularly. Trividacha apara, kostham shakha marmastischa sandishu, iti uktam vidibhedena doshanam trivida gati. How it is? Coast, that is a direction towards the coast. Coast, in short, cells, organs, a vertical, very particular, covered by a space, covered a space. That is called cells in short scientifically. And shaka means a structural or semi-solid body structure, a cell which is known as shaka marga. And dosha factor or substances goes towards the movements, goes towards the shaka, that is called shaka gati, and supposed to be substance or any molecular attraction if goes towards the costa, then it is it's known as a costa gati or coast of functions or directions. And last third one, marmasti sandhi. Marmasti sandhi, it's very clearly indicates it's a very deeperly situation or systemic situation, or just like for the vital organs, just like nervous system, brain, etc. Are very complicated situations or complicated part of the body, or very, I mean to say, very delicate part of, whereas the such a those factors when situated or located or goes towards that, then a responsive following disease, which disease are very difficult to treat the disease, or many times not curable of the such a disease. So the course, when the directions or movements of the substance goes towards the coast or cell and resulted into the disorder, such a disorder may easy to cure because of we can easy to eliminate, easy to expel, or easy to eliminate the disease from nearer way or from the organs by the help of panchakarma procedures like emesis and purgative like procedures. Then shakha marga, or that is a pathway which is called as a pathway of pathogenesis, which is the part which is structural and not a cellular or spacious, but that's the structural semi-solid body components and part of abdomen and part of shakha or branches like called as shakha, and motion towards this is called as shakha gati. This shakha gati means motion, and this particular disease situated supposed to be in the shakha. It's such a particular disease we can cure, not easily to cure. And the last third one is marmasti sandhigat, whereas such a situated delicate organ, nervous systems, brains, or any vital organs, supposed to be here, substance or dosha factor or morbid factor, if go towards the in deeper situation, at their in deeper situation or nervous system or bone marrow in deeper or at very micro or ultra micro level, we cannot easy to cure such a diseases. So this concept we must have to understand by um, understanding with this particular motion concept or movement of the dosha factor. Another third one concept with this moment of the dosha or morbid factor, that is called ashay apakarsha. How it is? Ashay means space. Ashay means organ. The dosh factor or morbid factor when goes towards the ashay or organ, that is known as ashay apakarsha. That is because of a negative potential or negative pressure is created when in the particular organ that may absorb or may secrete inside the organ or costa, that is called ashay apakarsha gati. That is because of natural requirement, and that particular ashay apakarsha gati may take place because of both way, that is because of preventive natural defense mechanism by our body or by the procedure of primary procedures of the panchakarma. We can try to uh, x-ray the substance from nearer way by this ashay. So every panchakarma physician or panchakarma expert can understand this ashayapakarsha gati for purpose to diagnose, for purpose to decide the line of treatment in the panchakarma procedures especially. Then fourth type of motion or movements of the morbid factor, that is upward direction. In other words, urdhva gati, then downward directions, and third one is the tiryak direction, that is oblique or lateral, or even we can come to understand with the physical circular motion, that is also we can consider with this the circular motion, oblique motion, and lateral motion. These are the tiryak type of the motions or movement of the morbid factor. So normal functioning naturally gives us health, and abnormal function gives us the pathogenesis. Or abnormal functions or opposite functions or disturbed functions or any opposite or obstacles in the systemic phenomena or systemic movements or mm, this type of motions may cause of disease and disorders. Then we come to talk about the how motion or movements are going to take place. When we see or undergo the study of the particular Vad Dosh Gati, very particularly meaning of the Gati, Va Gati Gandhanayor Iti. Va Gati Gandhanayor Iti means what exactly here? Mainly, Gati means all type of movements. And very particularly, Gandhan means what exactly here? Gandhan means to input motions or input movements or input by the help of input devices, by the help of informatory devices. And the this Gati is the very particular function of the Vata dosh, whereas which indicates movements, functions, or direction of the flow, it depends on the function of Vata dosh. So here we can come to understand very typically again as their classification pranagati. Suppose a vital function pranagati to inside or inside directions in the body, just like as the inspiration or intake of food or sensory functions by the help of our sensory organs, that is also pranagati or a function of the pranavayu, which is inward towards the inward towards the human body. Then udanagati is the outer side of the body. These functions or these motions or movements always in upward direction and outside of the body or outlets of the body. That is a very simple example with this. That is expiration. That is called ushwas or that is called respiration. Samanagati is another third one, which is Samanagati. You know very well this reference with this. Samano Agnisamipastha, Koste Charati Sarvata, Annam Grunati Pachati Vivecheti Munchati. Means these are the functions of the Samana Vayu. These are the movements of the Samana Vayu that functions always functioning around a clock or in the GI tract, in the particularly Annavashrotas. The that is, in other words, absorption or intake, assimilations or digestion or push or pull, both things are sorting and analysis. These movements of the Vad dosh function is expressed by Samana Vayu, that is known as the Samanagati. Then Vanagati, in other words, in today's language, blood circulation or movement of supply, the blood, serum, or whatever the nutrients by the help of circulation, by the help of circular movements. With the example of cardiac cycle or blood circulation, we can easy to understand these things, right? Then fifth one, that is apanagati. Apanagati is always go towards the outside of the body or lower side of the body or downward direction. That is the one of the part of the function which functions to expel out, throw out the wasted material inside the body. So it is very clear. Apano, apanaga, medra urogochara, shakrun mutra, medra apano, apanaga means downward direction. And whatever the Malamatra Nishkramana Kriya, these are the functions. Whatever the wasted, in form of the liquid, in form of the solid, that is stool, feces, or urine, these material, wasted materials go outside of the body or excrete outside the body by the help of apanagati. And these all five types of gati, the part of vata dosh functions is always essential to go in their directions naturally unless the suppression or disturbances or obstacle in between this any type of physiological these five functions may cause of pathogenesis, may cause of several disorders. So it's a very clearly mentioned suppression of natural urges are mainly cause of several diseases. Then lastly, we come to conclude what is the concept and how it's advantage and disadvantage, how we can apply in our professional science or our medical science. So we come to see one by one the conclusions and importance of this discussion of this topic. Number one, pathogenesis. By the help of this, if we understand the very particular this concept, then only possible to understand very particular pathogens of disease as perfect as possible. Doshagati concept play a very important role in understanding of macro, micro, and ultra micro pathogens of the diseases. So, pathogens of the natural suppression of the natural urges, disobey of the natural urges, or obstruction of the natural urges may cause of disease, and obey the motions, obey the movements of these concepts or movements, obey the moments, obey the these particular gati, we can we can have a health of the human beings. So we must have to follow the natural urges and follow the natural urges or this type of movements or gati I mean to say here. Then second one benefit is there. If we understand and undergo the details of this gati concept with the biophysics, then we can very easy to diagnose and very perfect diagnosis is possible only. And also we can decide the prognosis of concept, how the movement is disturbed, how and what exact initiative of the pathogenesis movement for responsible for the pathogenesis we can understand, and we can by the help of this we can easy to decide the line of treatment, easy to decide the further management of the disease. Then if we can easy to understand also topic which is very tedious again, avrutta vikara especially. Avrutta vikara means avaranjanita vikara, unless and until we cannot understand the avrutta vikara particularly, because if we see the all concept of motion or movements of the body, movement of the substance inside the body in the physiological phenomena, then only we can possible to understand the avruttavata vikara. Fourth one, very particular advantage or benefit for us, decide the management of panchakarma even depends upon the knowledge of this motion concept or this concept of the gati. So there are two references are given here. शमयेत् तान प्रयोगेन सुखम वा कोष्ठम आनयेत् ज्ञात्वा कोष्ठम प्रपन्नाश्च यथासन्नम विनिरहति. Means what exactly? You know very well. You try to understand first the directions or movements of the substance or those factor, and as their abnormal movements, you should try to expel out from the body by the help of panchakarma procedure, or eliminate the dosh factor which are harmful to the body. We can expel out or we can eliminate from the body by the help of the panchakarma procedure. So they are very clearly described the importance of this particular movements and their benefits in the panchakarma particularly. Dosha yanti tata tabhya is another one reference, very important to understand this concept. Dosha yanti tata tabhya shrotomukha vishodhana. Shrotomukha vishodhana. Many times the structural or semi-solid obstruction in between the systemic phenomena. Disturbances, the movements, disturbances, the motions or systemic phenomena. At that time, we cannot go directly the for Panchakarma. So before that, we should Shroto Mukha Vishodhan is very important. Our pachan or digestion or dissolve that particular toxic substance or samata before adopt the Panchakarma, before decide the Panchakarma. We should, and for particularly again, they have given the instruction before adopt the Panchakarma, try to aggravate the substance and expelled out from the Shakha or structural Shakha Marga to Coast Marga. Then you will go for the Panchakarma lastly, at last. Then fourth one benefit is there. If we understand the dosha concept, dosha gati concept, then we can easy to decide line of treatment of the disease and very perfectly we can manage the disease. Last one, our research scholars, our UG scholars, or our even guest Nidan faculties are important to know or important to undergo the study of details again. No doubt, it's a very complicated because of comprehensive, because of we must have to understand with the physics or biophysics, but we must have to undergo study with this bioelectro. What do you mean the bioelectromagnetism, biomechanism, or biophysics or biochemistry? By the help of these consideration, by the help of these concepts, we must have to understand, we can understand the topic of this concept of movements or concept of motion, dosha motion, for purpose to uh, decide, for purpose to diagnose the disease, for purpose to decide the line of treatment, for purpose to decide the prognosis concept. And at last, if you have to any question regarding this, you can ask me. And at last, I would like to express from deep sense of mind, I am taking this opportunity to deliver the lecture, here. Um, who invited me here for Dr. Dudmal. So thank you very much to all. If you have
Thank you.
any question, you can ask me.
Thank you.
We
Thank
can
you
try
very
to
much,
explain here as possible.
Sir, there is one question in chat box.
Yeah.
Sir, what is the difference between Koshtha Shakha Marma Asti Gati and Koshtha Shakha Marma Asti Vyadhi Marg?
Coast Shaka.
Koshtha Shakha Marma Asti Gati, ये
Yes,
question है.
will.
And Koshtha Shakha Marma Asti Vyadhi Marg.
No, these are the three types of movements. When the vitiated dosha factor or substance goes towards the deeper situation, that is called marmasti sandhigat marga. And when goes towards the coast or space or a organ, that is called coast marga. And when goes towards the shaka or structural organs, that is known as shaka marga. And when such a substances or morbid factor goes towards the deeper situations, that particular moment or those diseases are very difficult to treat, or many times not so easily curable. And that is the Rogamarg. But so there is very clearly classified Coast Margagat disorders and Shaka Margagat disorders, and last one Marmanasti Sandhigat diseases and disorders.
Okay.
Is there any questions again with this concern?
No, sir. No any question.
No doubt this topic is very tedious, and
yes, sir.
when we try to understand with comprehensively with the biophysics, definitely, but very keen observation, and we should attend our pay of attention pay of attention is very essential here. I mean to say,
Yes, sir. Yes, sir.
because motions
Definitely.
of any substance or any morbid factor depends upon the attraction between the two molecules or substance. Repulsion and attraction is depends upon their natural attributes of their substance or morbid substances. And again, flow is type of direction. Flow means just supposed to be Prithvi, Aap, Tej, Vayu. These are the four particular major elements are there. Are every molecules in every molecule or substance in the body are made from these all five major components, major elements. And when molecules made from this, and their specific dominance depends their motions. You know, supposed to be, I would take a example for the supposed to be a substance is semi-solid or structural. It goes towards the always downwards. That is called as gravitational force. That is called a movement of the semi-solid substance, just like either faces or stool, always go toward the lower direction. And aap means tej, fluid. Aap means jal or fluid, which always go movements always to upper direction, upper level to lower direction, a lower level. The movement of the any fluid from lower higher level to lower level. Again, another one supposed to be tej or agni mahabut dominance substance in the body, that is always positive potential to negative potential. That flow of the electric current is always positive potential to negative potential. And also supposed to be vata dosha dominance is substance is there, then always from positive pressure to negative pressure. This concept of motion is very important to know before undergo the study of pathogens of every disease. Is there any questions again?
No, sir.
Substances, or you may call it as a rasa, rakta, mans, med, asti, or any structural substance inside the body, that is the kapha molecules, or with the pitta dominant molecules, or movements, or the such a gati is it only depends upon the force applied from the external. Displacement or changes of the substance or movement of the changes not possible without any kind of energy or force applied by outside or from other side. That is law, Newton's law of motion. And the first, second, third, these third and three laws of Newton's law of substance is very important. Three laws of motion is very important to understand before undergo the study of this gati, particular dosha gati concept.
Yes.
Is there any questions?
No, sir. Same repeat question was there.
Okay,
So
I can see also.
I'm very thankful to Dr. Potdar sir, who has enlightened us today on the very important and very different aspect regarding the sharir or physiology about Ayurveda. It is not always dosh dhatu mala or dosh. We can think about biomolecular level.
Yeah.
So sir has shown thrown some light on this topic also. So we would like to continue with this topic. So we need another lecture or two from your side on this
We
topic
can
also.
we can take another topic very similar to with this,
Yes,
the
sir.
Avrutvata Vikara.
Yes, sir. Definitely, sir.
Avruta Vikara.
Yes, sir.
But again, this is very tedious. We must have to undergo with this, the biophysics and biochemistry.
Yes, sir.
And very important to know what do you mean the bioelectromagnetism and biomechanisms.
Yes, sir.
And
Sir, actually, this term has to be included in Rognidan study also now. Not
Yes,
UG, at least at the PG level, we can
yes,
do
yes.
it.
This lecture is particularly delivered for the postgrad students,
Yes, sir.
especially.
Yes, sir.
For UG level, this is very huge
Very
and very tough topic for that.
tough topic for them.
Uh,
Sometimes
for
they will
tough,
not understand.
this is very tough and very tedious and complicated to understand for the undergraduate students.
Yes, sir. We can add this type of terms or syllabus or another aspect regarding with biophysics,
Yes, sir.
bioelectronics, and
Yes, yes. There is a scope to add there, and essential to
bioelectromagnetism
for
also.
yes, 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 yes. Very essential to add the our syllabus and curriculum, but it's essential to understand and essential to read very particularly our postgraduate students only.
Sir, how can we? One question from my side, sir.
Yeah.
Sir, how can we incorporate Nidan subject as in bioengineering? When I gone through your CV, I seen that you have given a lecture on bioengineering. So,
Okay. Okay.
can you say a point or two on this topic, sir?
Sure.
Yes, sir.
Yeah, there is one more field is there, biomedical instrumentation engineering,
Yes,
or
sir.
biomedical instrumentation is there, BMIC department is there. Biomedical instrumentation, such engineers are designing new devices as required to the physician, as required to the our doctors. So this field is very supportive for we people, and we always think over it with this, because our Sushrut has already stated, ekam shastram adhyano na vidyat shastra nishayam tasmat bhushrita shastram vijanyat chikitsakaha. So biomedical, not only the biomedical engineering, not only the genetic engineering, not only the biomedical engineering or electronic engineering, supportable or useful to us. There are so many uh, sciences or branches of sciences, just like as environmental science, biomedical science, and life sciences, microbiology, biochemistry, biophysics. All these branches of sciences are very supportable to us for purpose to understand the pathogens of the disease. Very
Yes.
supportive to understand the how we decide the line of treatment, how we understand their prognosis and all. There are so many instruments in our the medical field. There are so many diagnostic tools in our medical field. Even uh, even today, day by day, the well equipped and well diagnostic tools are coming into the medical field by the help of by actually the help of well developed science and technology. We are now available, we are now we have got a lot of diagnostic tools for the observe the very particular what is going on inside the body, what is going into that. You know very well the endoscopic investigation methods or
Yes, sir.
angiographic investigation methods are, and another many advanced diagnostic tools are coming for this our medical field.
Yes, sir. Definitely, sir. Sir.
Is there any questions
No, sir. No any questions, sir.
from
On the,
audience? Audience are not very much interested, I think so.
no, sir. They are interested.
Because this time I think very few people are joined here.
Sir, at maximum level 39 where participants were present.
Okay,
think,
this time I think
नहीं नहीं
here only 13.
अभी शुरू हुआ था सर तो 39 थे.
Okay, okay.
धीरे धीरे कम हो गए शायद, डिस्कशन नहीं करना चाहते थे. Might be possible.
And nobody have a time.
No, sir, it's not like that.
All they are interested in only pass out there and enjoy their life.
Actually,
Okay.
my college is also UG college, so I have asked for second year students
Yeah.
to join the lecture. 2-3 students joined. Rest students,
Yes,
I think they
yes.
are enjoying Ganesh festival or is going on
Right,
their
right.
college.
And many more students are appearing the MD exams also. There are
Yes, sir.
pre-MD exams and also postgraduate students final examinations are there.
Post-graduate.
Yeah, yeah. Okay, no problem.
Yes, sir.
Koleji, thank you
Yes,
very
sir.
much for
Thank you.
inviting and thank you very much. Definitely we
Thank you
will
very much,
decide
sir.
next time on Avrat Vatavikar or Avrat
Yes, sir.
Vikar. Thank you very
Thank
much.
you. Thank you very much, sir. On the behalf of Academy of Rogamarg, I am very thankful to Dr. Vijay Potdar, sir, who has shown us a path and light towards this path. That is how to modernize Ayurveda physiology and Ayurvedic pathology without disturbing the actual flavor of Ayurveda. So just we have to mention the new terms, biophysics, iogenomics, and other uh, bioelectromagnetism, we can say. So, and whenever sir has said that Rogagati and Rogamarg, both are not exactly same, but there is very much difference. And sir has elaborated that topic very well. So I congratulate them and thankful to Dr. Poddar sir. So
Thank you very much.
with this note, with the permission of today's guest speaker, Dr. Poddar sir, we would like to conclude today's lecture. Okay, sir.
Thank you.
Thank you.
Thank you very
Thank
much.
you, sir.
Thank you very much.